what is hysteroscopy? Hysteroscopy means, hystero means uterus and scopy means visualization. So it means that visualization of internal cavity of uterus. So we know that a successful pregnancy is possible only when the uterine cavity is good enough for a normal embryo to implant, and that results in a successful pregnancy. So many patients who are undergoing IVF or patients with infertility often ask this question whether hysteroscopy would be required for them. So the answer is not every patient requires this procedure of hysteroscopy. So we all know that during the first initial visits of a female patient, we do ultrasonography of the pelvic organs to ascertain how our pelvic organs are there, the ovaries and the uterus. So we do an advanced ultrasound called as 3D ultrasonography, which determines how the internal cavity of the uterus is, whether the internal cavity of uterus is having any pathologies like polyps, fibroids, or any adhesions or these things. So only if the patient is diagnosed to have a uterine anomaly in the form of bicornuate uterus or a septate uterus, or patients who are having polyps, fibroids or adhesions, only such patients will be subjected to hysteroscopy, so that any pathology which can be found during the hysteroscopy can be corrected in the same setting. So the patients who are infertile, if they have any of these pathologies, will be definitely subjected to hysteroscopy. Thereafter, the patient can give a natural try or treatment through an IUI or IVF. The most commonly asked question is whether hysteroscopy is mandatory for all patients who are undergoing IVF treatment. Again, the answer is no. During the IVF stimulation and also during the 3D ultrasonography, a fertility specialist gets a fair idea about how the uterine cavity is, how the endometrial thickness is coming, and that decides whether the hysteroscopy would be required prior to an embryo transfer cycle. Now, suppose during your IVF treatment or during your routine pelvic ultrasonography, if you have any of these pathologies like a thin endometrium, too much thickened endometrium, or any pathologies like uterine anomalies, fibroids, polyps, then definitely you will be suggested to undergo a hysteroscopy. There are a set of patients like patients with repeated implantation failures, patients with recurrent pregnancy losses, patients with thin endometrium, or those who have undergone some sort of surgeries on the uterus, and patients who have previous history of genital tuberculosis or abdominal tuberculosis. So these are the patients, even if we don't find any obvious pathology on the pelvic ultrasonography, it's important to undergo a hysteroscopy in order to increase their chances after an embryo transfer cycle. So I hope that I have cleared all your doubts about the hysteroscopy procedure. And this generally the hysteroscopy is done under anesthesia, and it's a simple daycare procedure without much complications. So if you have any queries about hysteroscopy, you can consult our fertility specialist at Milan Fertility Center, Bangalore.